welcome. I'm Suzy Plows. I'm with CAIPE in the UK, and then I'm also with the communication working group for Interprofessional Global. So today we've got a great presentation from two of our colleagues out of South Africa. So we've got Dr. Luzaan Africa. She's a lecturer and interprofessional clinical supervisor in the Interprofessional Education Unit in the Faculty of Community and Health Sciences at the University of Western Cape. She's actively involved in the development and implementation of an interprofessional curriculum. She is a part of a team that offers interprofessional collaborative practice supervision to senior health science students. In her capacity as lecturer, she teaches and convenes interprofessional modules to undergraduate and postgraduate health and social science students. She joined the unit in 2016 after nearly 2 years in private practice, and she holds a bachelor's in science in physiotherapy, a master's in science in physiotherapy, and a PhD in physiotherapy. Her research interests include interprofessional education and collaborative practice, primary health care, and health professions education. And then we have Dr. Gérard Filies, is a registered occupational therapist by profession. The title of his PhD study was Development of an Interprofessional Education Model that aims to instill the core competencies of interprofessional collaborative practice in allied health students' curriculum. At UWC, he is a full-time senior lecturer and chairperson of the Interprofessional Education Unit in the Faculty of Community and Health Sciences. Dr. Gérard Filies is a part of the team that was appointed as convener for driving the process for registration and accreditation of the postgraduate diploma in interprofessional education and health, a first of its kind in the Western Cape, if not a first in South Africa. Dr. Filies is the current chairperson of the African Interprofessional Network and serves as the steering committee of Interprofessional Research.Global. He was recently acknowledged by the World Health Organization for his expertise and longstanding commitment to advancing education in the critical field of interprofessional education and collaborative practice. And he was invited to be a member of the Curriculum Development Advisory Group under the World Health Organization Regional Office for Africa. This advisory group will focus on advising the development of prototype competency-based curricula for selected health profession programs for Africa, supporting the region in building a robust and sustainable healthcare workforce. So welcome both, and thank you very much for presenting. Really excited to hear what you have to say today.
Thank you so much, Suzy, for the warm welcome. And I'd like to say thank you for colleagues for joining us for this afternoon's webinar. Myself and Luzaan are quite passionate about IPE, and we are very happy this afternoon to share with you a presentation called Rerouting the Interprofessional Curriculum, the Interprofessional Education Passport, and the Quest for an Interprofessional Identity. So colleagues, before we proceed, we have to give acknowledgement to key people who has been involved in the development of our IPE curriculum. Firstly, we want to acknowledge Professor Fedrosa Wahi for starting the Interprofessional Education Unit and was instrumental in the design of the very first interprofessional module at our university and subsequent modules that followed across the continuum of learning. And then also acknowledging Professor Simone Titus, who was our teaching and learning specialist, who played a key role in the development of some key initiatives in our unit, Ms. Lebika Jaffer, Mrs. Shamila Hamid, Dr. Lucanio Nyati, who's part of our unit, and then also our graduate lecturing assistants, Palosho and Irene. Thank you. Right. So I think before we get into the key aspects around our presentation, I think we wanted to give you an understanding of what our curriculum looks like at the University of the Western Cape. So it is staggered across the continuum of learning, starting from the first year and right up until the postgraduate level, and then also looking at interventions with the staff. So at the first year level, we have a theoretical module. It's called primary healthcare. We realized right in the beginning that all our health science students need to know about primary healthcare because our health system was based on primary healthcare. And so this was easy to decide upon, and I was involved in that planning team where we actually took all departments, had a few workshops to identify what is a common aspect across all the health sciences departments. And it was decided that each department somewhere in the curriculum speaks about primary health care. And so that was the first module. This module is compulsory for all first year students. And we even extended this module to other faculties. So our faculty of dentistry was a faculty on their own. We included in the module. And then I also had, discussions with our pharmacy department, and they sit in the science faculty to also be included in this module. So if we look at all the departments, and I'm not going to go into the different disciplines, but there's a total of just about 1,000 or just over 1,000 students participating in this module at the first year level. From the primary healthcare module, we speak about comprehensive primary healthcare. And one of the aspects of comprehensive primary healthcare is health promotion. So we build on this module into the second year, and we have a specific focus on interdisciplinary health promotion. It's a service learning module in that in the second year, we actually take students out to schools in the surrounding areas, and they have an opportunity to do a needs assessment and implement a mini project based on the health promotion planning cycle. In particular, we look at the school setting. So we're looking at not health promotion as a whole, but health promotion within schools. Then at the third and fourth year levels, we have various interventions. So the first and the second year module counts for credits. The second year module doesn't include all the disciplines, but most of the health sciences disciplines. And then at the third year level, we have specific sites in the communities where the third and fourth year students get involved. But we also have activities on campus where they can have the opportunity to engage with other disciplines. So the first initiative is our Interprofessional Education Supervision. This is where staff in our unit who act as interprofessional supervisors identify where students from two and more disciplines are placed, either at a hospital or clinic setting, or even in the community setting. Our supervisors then go out to these sites and at least once a week facilitate discussions with our students around if there's a common client that they are seeing or patient. And if not, they would use a case study to facilitate an interprofessional discussion and engage each of the disciplines present there around what possible interventions they could do as an interprofessional team. Then, quite a number of years back, I realized that our community sites, some of the students will sort of move through the site, but not all the students, because they will go to other sites. And as a result, I realized that they might be missing out on an IPE opportunity. So we developed something called the IPE World Cafes. This is one day where the students, it's an open invitation to all departments to send as many students as possible. And we have once per quarter an event on campus where all students are invited. At this event, we dispel myths around each profession. So we have an exciting activity where we say all the nurses in the room be quiet, and we ask the other disciplines what they think nurses do. And then we hear funny stories about what each of the disciplines do, and then we get one participant from each discipline to give us the definition and to clear up those myths. Then we give them a case study, and in interprofessional teams, they actually unpack the case study, decide on how they would do an assessment, and plan an intervention. I'm not going to go into detail around this, but we do realize that each discipline has their own assessment tools and intervention plans. And for this reason, our unit decided to come up with a uniform tool for all disciplines. and we can speak about that again. Then we also realized that most students at the third year level begin to speak about research, or there's a research module, and we identified this as an opportunity to collaborate. So a number of departments in our faculty collaborate on a shared research module. And then we also have an IPE ethics. And for now, I'm going to call it a World Cafe because one of our World Cafes have a specific ethics focus. But our faculty is moving towards establishing an IPE ethics module over the next year or two. Then at the postgraduate level, we realize that there's a cohort of health professionals that have not gone through our IPE curriculum. They're in the system for a number of years. And when our students go out to facilities, there's a gap because they work interprofessionally, but the health professionals that have been in the health system for a while still operate in silos. And so to bridge that gap and to bring them up to speed about changes in the curriculum, we developed a postgraduate diploma in interprofessional education. It's a 1-year fully online program, and health professionals can see this almost as like a staff development opportunity to up their skills and to gain knowledge around working collaboratively. We also have a master's in health data analytics, an IPE short course, as well as a health data analytics short course that we've ran last year. And then we also realized now that the students are upgrading their skills and we've changed the curriculum, we need to do staff development activities. So our unit is responsible for facilitating webinars within our faculty and also staff workshops so that we all begin speaking the same language and that we're all on the same page. And so as you will see, our curriculum stretches from first year right across postgraduate and even includes the staff. And what the presentation is about is how the necessary core competencies are aligned to each of these activities at the different year levels. And it's geared towards getting our students to be collaborative practice ready, which we will expand on in a minute. Luzaan, you're welcome to add or move on to the next slide.
Thanks, Gérard. I think you've covered it. I was joking with Suzy in the beginning that Gérard told me we only have an hour, Luzaan, so calm down. So I'm really going to try to be as concise as possible. But I become really excited when speaking about things like this. And luckily I have Gérard here in my eye. So he can tell me and just show me, Luzaan, relax. So the IPE passport at UWC is what, and we sat in a staff meeting one day and we realized that this is a journey that students go on towards being collaborative practice ready. And so this journey, we really wanted to find out, so what is it that this journey is taking them on? And Gérard went on a trip. So usually when Gérard goes on a trip, I know when he gets back, I'm going to have more work. And so for the entire time that I was part of the unit, we always focused on the core competencies. And Gérard went on this one particular trip, won't mention the country, and when he got back, Gérard was obsessing over interprofessional identities. And so we realized that the way we all share identity is to show your passport. Wherever you are traveling to, you show your passport. And so while we focused on ensuring that our students are competent in IPE, CP, and we want them to show the interprofessional core competencies, we realized that we needed to develop this interprofessional identity within students. And one mistake that the staff made was to give me that metaphor to play around with, because I really enjoy metaphors. So I went off. So the university is our airline, and our students pass through various border control points, and they earn stamps to this passport. And at the end, this passport shows their interprofessional identity development, or the development of this interprofessional identity. I'll go into detail around that. Just going to move to the next slide. So you'll see that we called it a reroute. Initially, when we started presenting this work, we actually presented it at SAI last year. We spoke about navigating an interprofessional curriculum. and the Interprofessional Education Passport and the quest for an interprofessional identity. But in that study that we conducted, I'm going to share a bit of the findings that came out of that study. But in that study, we realized that things were not aligning to what the global frameworks are speaking about. And so we felt that we needed to check our curriculum. So we are sharing our curriculum. The Interprofessional Education unit at the University of the Western Cape is often asked to share information on how we run our curriculum. But we struggle to sometimes find that alignment with our global frameworks. And so what we then did was we wanted to find out, were we actively and effectively developing the interprofessional identity in our students? And besides that, were we actually assessing it properly with this interprofessional passport? And so I'll share a bit of that findings with you, but that then realized that we need to reroute this quest. We need to find a new way to get to this interprofessional identity. And so in terms of the development of this identity, this was someone that Gérard also had quite extensive conversations with in terms of identity development, but we found the interprofessional socialization framework. And this framework outlines 3 stages, and I'm going to hand over to Gérard, if I'm correct.
Yeah.
I'm going to hand over to Gérard, who's going to share a bit more about this development using the framework.
Thank you, Luzaan. So, as Luzaan mentioned, social identity framework, it can be used to cultivate an interprofessional identity among students in healthcare education programs. It has 3 stages. So the 3 stages are pre-socialization. This is where you familiarize students with the notion of interprofessional collaboration and emphasize the need of cultivating an interprofessional identity. So we have to realize that many of us do IPE activities, but does it lead to an interprofessional identity at the end of the day? Because when the students graduate, they develop or they graduate with an identity of a nurse, an occupational therapist, a medical doctor, but where does the identity of working interprofessionally fit in? And so students have to be socialized into this. It has to be part of their training. And this is through these 3 stages. Stage 2 is the formal socialization. So it's structured learning activities that foster interprofessional teamwork, such as team projects and simulated scenarios. And then there are also informal ways of doing this through stage 3. So it's unstructured learning activities that foster interprofessional collaboration, such as social and informal discussions. And I think we mustn't forget or dismiss the notion of students developing this identity through themselves and engagement in social spaces with each other. Okay, Luzaan. So using this framework, now remember our interprofessional education unit. This year, our unit is about 24 years old. So that's as long as we've been doing IPE. Many of the activities were around theoretical models. So if you think about the slide I did in the beginning, from year 1 until postgrad, there's many activities happening, but we never thought about how well we are doing these activities. And if we look at the social identity framework and the 3 stages, it actually gave us a framework to plot our curriculum and to look at how well we are doing it and how our students have been developing this identity. So I'm not going to go through all the words. I know the slide is busy. What I really want you to focus on are right in the top, the 3 stages. And you will look at the 3 stages. For example, stage 1, there are 2 stages or 2 processes under there. So familiarize the student with the notion of interprofessional collaboration, and then emphasize the need of cultivating an interprofessional identity. So just using that example, and if we look at our first year module, we actually took all the learning outcomes. So all the page numbers that you see is from our own learning material. But we actually took out these outcomes and we plotted it in this framework. Now you can already see in stage 1, there's a gap by the second step. And so we have not emphasized the need of cultivating an interprofessional identity. If we follow just that column through into the second year, you can already see in stage 1, we are missing information there and we are not incorporating this. We haven't incorporated it into our curriculum. Our focus was there in stage 2. And then in the World Café in the senior years and the IPE supervision, again, you can see not all blocks are filled. So this was very helpful to us because when we looked at the student just before graduation, we couldn't say for sure that the students have developed an interprofessional identity. Yes, they knew, they had knowledge about what IPE was, and we spoke a lot to them about interprofessional core competencies. We often refer to the core competencies and how they were linked to each year level. And we thought in our minds, if we ensured that these core competencies were installed in our students from year 1 to year 4, and integrating it at the postgrad level, that would be enough. But now, using our passport and this framework, it actually showed us that there are gaps within developing this identity. So you can see just by plotting it on this framework, it actually showed us where we needed to do more work and how we needed to install this identity so that when their passport gets stamped at 4th year, they have all the ticks and they can pass through the border into the workplace. And us as educators can have the assurance that they have attained the competencies, but most importantly, that they've identified this identity, the interprofessional identity, so that if they are working in a hospital setting and there's an OT department, they won't work within that silo, within that department, but working with a client, they will realize the need for a physiotherapist, to work with a social worker, the psychologist, and that identity is then installed alongside their professional identity, but having an interprofessional identity as well. Luzaan, do you want to add anything to this slide?
I think I'm good for now. Thank you, Gérard.
Okay, you can go to the next. Right, so looking at the 3 stages, it actually helped us to align our curriculum to the stages. So again, at the first stage, the purpose of this is to introduce IPE and the value of having an interprofessional identity. And this we did at our first year level module, so the primary healthcare module. And here we really needed to familiarize the students with the notion of IPE. So we introduce them to the concept. We speak to them about the importance of core competencies and how this first module are linked to some of the IPE core competencies. Then at the second year level, we emphasize the need of cultivating an interprofessional identity because here the students go out into the community, they work within an interprofessional team, and they actually go and implement a mini project. And so this interprofessional identity is introduced to them where they realize, but I'm working with others across disciplines, and I need to now put on a different hat. And so the outcome was familiarization with the IPE concepts and the initial steps towards interprofessional identity formation. So we introduce it, but it needs to be carried through into the next stages. So you can go to the next. The second stage is formal socialization, and this is where we're strengthening interprofessional collaboration through shared academic work. Now, remember our curriculum, we spoke about opportunities like the shared research module, where it's a structured learning activity. Students are introduced to different concepts around research methodology, and they actually have to work in an interprofessional team to address a research problem, and they actually do the research and write a report. So here the expectation is that there's a deeper understanding of teamwork in academic settings, because now they have to think about a certain problem within the interprofessional teams. They have to start bonding as a team and working through a research problem. And so this relationship is strengthened, and the interprofessional identity is reinforced through formal academic activities like shared research, like our IPE World Café, etc. Next one, Luzaan. Then the third stage is the informal socializations. And this is where we facilitate informal discussions and reflections on interprofessional work. So again, the example that we're giving here is our World Cafes. So it's unstructured learning activities. Now, these don't count for credits. So it's activities that we organize as the Interprofessional Education Unit. Some of the departments don't even use this for assessment purposes. And so it's really an opportunity for us just to engage with the students and give them the opportunity to learn what the other disciplines are about and what they have to offer around a scenario that we've given to them in the form of a case study. And this really gives them the opportunity to increase their confidence in interprofessional communication and collaboration. So we try and make it fun for them. We sometimes incorporate social media where they have to use platforms like Facebook and Twitter and things like that. And during the World Cafes, they can actually post comments where some of our facilitators will respond to them, because the World Cafes can be anything from 100 to 200 students. So as facilitators, it gets quite busy, and we don't often get to each group, but we use social media as a platform for the students to actually, during a learning activity, to post comments, to take pictures and post it, and our facilitators will respond to them in that way. And so it's a fun exercise. They make new friends. They get to unpack case studies that they normally don't just within their own department or discipline. Thank you, Luzaan. Next slide. Handing back to you, Luzaan.
Thank you, Gérard. So as Gérard mentioned, that at every stage we have these key activities that we conduct. And so what we learned from when we did the assessment of our content, we really wanted to see, do those activities actually align with what we are supposed to be doing at the respective year levels of a student? And another one of Gérard's quests, he went overseas, came back and came with, he first went off on EPAS, so the Entrustable Professional Activity, Entrustable Professional Activities, Gérard? Is that the term? Not? Yes. And then later, he expanded that to be, I don't know if there was another trip involved, but that became the Interprofessional Entrustable Professional Activities. And obviously, at that time, I told myself, I'm not doing this. I'm not going to explore more. I made the mistake and I read one article and off I went. And what I realized there in that reading is that it aligns so nicely with how we want to scaffold our curriculum. So at the first year level, we do expect students to have a theoretical base of whatever it is we are teaching them. We want to know, did you obtain the knowledge, yes or no? And so the activity at that first year level has to be the no. So this aligns with the framework that the Interprofessional EPAS gives us. And so all we want to know is, do they know what it is, what interprofessional education is? And that aligns with familiarizing a student with the notion of interprofessional collaboration. At the second year level, we want to know, does a student know how? And so the activity that we do that feeds into this passport is the know-how. The student has to show us, do they know how? At the third year level, we want them to show us how. So they need to be able to perform the activity in a supervised setting. So the shared research module, like Gérard mentioned, there's a supervisor, a research supervisor that oversees the group activity. And then at the fourth year level, we want the students to perform the activity in an unsupervised setting for them to show us that they are fully competent. And so in this unsupervised setting, the students then come together, they have this discussion, and they are showing us that they can do what they are expected to do. So now we have all these activities, we use the framework to plot our activities, but now we need to actually assess the development of this identity. So the RIPID, another one of Gérard's quests. So the rubric Interprofessional Identity Development has 8, it's quite small on the screen, but it has 8 different points that gets assessed when you want to assess the development of a student. I'll add the reference to this rubric I'll add. But so there are 8 different points that get assessed. But what we wanted to know is, in our previous state, before we did the rerouting, were we truly assessing the development of this identity? And what we did was we took our passport and all the rubrics in our passport for the 4 activities that we conducted over the 4 years, and we plotted it into this rubric to find out. And what we found was shocking, that we were definitely not assessing the development of this interprofessional identity. What we were assessing at the time, because all our rubrics were aligned with the core competencies, we were assessing whether students obtained and developed and enhanced those interprofessional core competencies, but we weren't assessing the identity development. And so the rerouting took place, and we then changed our approach to that. So there are 2 different types of rubrics that has to be considered. The first is the analytic rubric. And this is perfect for having a scaffolded curriculum, because this is where you then start assessing performance indicators that are related to a year level. So if, for example, you are looking at the first year level, what are the performance indicators that the student needs for the first year level? What aligns with everything that the student needs to know at that level? So what we did was we took the interprofessional core competencies and we developed rubrics based on those sub-competencies that align with familiarizing yourself with the notion of IPE. And all of those then were added, 4 of those, for each activity done at first year, second year, third year, and fourth year. They then made up the interprofessional passport as an analytic rubric. So this was done in isolation. You don't look at the student's first year entry when you are marking the second year entry. But what happens when a student completes the 4-year process? How do we truly know? And so it wouldn't be fair to only take the 4th year assessment, so the World Café. It wouldn't be fair on a student, because you want to see that development take place. And so we took the RIPID, and the RIPID will now be what we do at our Interprofessional Wellness Centre. So in our various communities, we have an Interprofessional Wellness Centre, which is a student-led clinic. We don't call it a clinic, but just for your picture, like a clinic setting, where students come in, students start, they do everything. They do the resource allocation per discipline. They set appointments. They engage with the stakeholders in the community, the people who refer to them. They run this clinic in its entirety. And what we do there is, when we run our interprofessional supervision there in that wellness center, we use the RIPID to see whether a student is truly developed this interprofessional identity. So we don't consider the passport when the students are there in this wellness center. We want to see how that passport led to them having this identity. So the wellness center ideally is that final boarding pass that they get by the time that they finish this interprofessional journey that they were on. Gérard, do you want to add anything before I move on?
Yes, thank you, Luzaan. I just wanted to mention that our IPE Wellness Center is based in the community. We have links with the Department of Health, and they are referral agents to the Wellness Center. So the Wellness Center is seen like an overflow facility for people that are on the waiting list and waiting to be seen in the hospitals and clinics in the surrounding area. But the wellness center is student-led. And so like Luzaan said, the students do everything. They book the appointments, they look at the resources. And actually for us, this is the culmination of collaborative practice. This is the opportunity where students actually work alongside other disciplines. and you can see collaborative practice in action. So we're very excited about this Wellness Centre. This is the second year that it's running now, and we have more departments coming on board. Just prior to the second year, we had just a pilot with physiotherapy, and last year we had more of an integration. This year, there's even more departments coming on board, and there's even planning within our faculty to develop other wellness centers in other community settings where our students are doing clinical practice. So this is a really exciting move for us at the University of the Western Cape, because beforehand we were doing a lot of theory, but we were not seeing how it results in collaborative practice. All right, thank you, Luzaan.
Thanks, Gérard. Then just the conclusion. So what we realized, and something Gérard and Professor Fidosa Wahid have been preaching about this for years. Obviously, I was not listening at the time, but I'm listening now. That instead of solely basing your curriculum on interprofessional core competencies, you have to consider the development of an interprofessional identity. And using the framework, the interprofessional socialization framework, as well as the RIPEN, can provide that framework for you to ensure that you are not only developing or cultivating the dual identities with your students, but that you are truly assessing that identity. So as more people come and speak to us and try to find out more about our curriculum, I think the important take-home message is that when you develop or redevelop or rework your IPE curricula, that these tools be used to identify the gaps and to almost help you plot the future of that curriculum for the effective development and assessment of that interprofessional identity. Gérard?
Yeah, so I think what we're presenting today is really how we are fine-tuning our IPE curriculum. And although we've been doing it for so long, it made us realize that the developing an interprofessional identity is key to collaborative practice. And so with this realization, and using the analogy of going on a flight, going on a trip, we're really wanting to take our students on this trip where with their IPE passport, and I want you to think about portfolios, because most of us expect our students to do a portfolio, but we are having an IPE passport, which is actually an IPE portfolio that they carry with them from their first year, and they get a stamp from our facilitators at each year level to say what competencies they've attained and how this identity has developed. And when they reach their fourth year, they actually have a whole portfolio of evidence of their IPE activities with competencies and identity. And actually at the Wellness Centre, we can see how this comes together and how this identity has formed, how they work with each other, how collaborative practice takes place. And for someone, I'm just speaking about myself, but I'm sure Luzaan shares this, but to actually see it in action, to see a group of students around a table discussing a case, it's like pure magic for me. So these frameworks have really helped us to realize where the gaps are and to help our students attain this interprofessional identity alongside their professional identity. And we are confident that through our training and through our IPE curriculum that we are producing future health professionals that have this interprofessional identity and can work collaboratively with others. And I do believe that this is going to change our health system by producing a different type of health professional. So I'm confident that, the changes we will be able to monitor over time and see how this has changed healthcare in our primary healthcare settings. So thank you, everybody. I think that's the end of our presentation. I'm not sure if Luzaan wants to add anything. Those are some of our references, but Luzaan, back to you.
Thank you. So I can share, but I'm scared we don't have enough time for questions. I can share the student guide that we share with students at the beginning of the year, just to show them what that guide looks like and to show you an example of our rubrics using the core competencies. But I'm not sure if we have enough time for it.
Yeah, no, we do. We've got time. And I think that we can, if whoever can stay a little bit longer, we can extend it a little bit later to suit since we started a bit later. But I just want to say thank you. It was a brilliant presentation. And I think most of in the chat, there aren't any too many questions, but very much the comments around, exemplary work. And this is the passport idea. And this is really kind of cutting edge, new, really inspiring, I think, for people. I bet for the students, it's actually quite fun too, because it makes it into, it's a bit different than just going through everything. If anybody has any questions, there was an initial question around the ethics, but that you did. I know you're going to send out some information to people, but just around, if you could give a little overview of what that portion is around the IP ethics sessions that you do. I think the World Cafes that you have that are turning into a module.
Yeah, thank you for the interest in the IPE ethics. And while Luzaan was speaking, I was just copying all the email addresses so to send people additional information. But the IPE ethics, as you know, with health professions education, especially at the senior years, it's quite difficult to find spaces in the curriculum. And so because we have been doing the IPE World Cafe for a number of years, the faculty actually identified this as an opportunity to convert one of the World Cafes into an IPE Ethics World Cafe. And so with back then, our teaching and learning deputy dean, she's our ethics expert. We collaborated with her. And what we did is we used the opportunity. So it's a one-day event or one morning where we introduce the students to what ethics is. So there's a lecture, there's an input, we use videos, and then we have a case study with an ethical dilemma, and we get the students to actually unpack that dilemma using a framework that was shared with them prior to giving them the case study. We've done this a few years, and the faculty has actually realized that we actually need an ethics module. So myself and our current deputy dean did a whole exercise where we looked at 5 departments in our faculty. We looked at all the learning outcomes, the content, how much credit it counts for. And we actually came up with ideas of how to develop this module. So we are thinking, not for this year, but for next year, to have like a block week or 2 where we can actually cross-teach and get our students in one venue where they can work with teams around an ethical dilemma, and even extending it beyond the block weeks to clinical practice. So not just a once-off 1 week, 2 week activity, but using it as really as introductory sessions to introduce them to the theory of ethics. And then while they're in clinical practice, they should then plan and get time together to actually go and meet and discuss a case and come back. And then later in the term, we actually get them together to actually present how they've engaged with each other. So at the moment, the IPE World Cafe is the ethics component. It's a one morning activity, but that's our thinking in terms of building it and developing it as a full-fledged module. The World Cafes, I mean, we can tell you long stories about it, but again, it's a once-off morning activity, 4 or 5 hour activity where we bring them together. Anyone's welcome, and we have 100 to 150 students in little groups, and we unpack the myths around each discipline that I mentioned. We give them a case study, and they have to unpack it, and they have to present it to the bigger group. And then we also got a bit adventurous. The World Cafe, we explored 1 year with doing an IPE amazing race. So I realized that the department send the students to the World Cafe and they stay behind. And so they're not up to date in terms of using the correct terminology with students, and their understanding has not developed over time. So with the amazing race, we get the departments to plan an activity in their department. And like the series on TV, World Cafe, where people run across the globe to complete challenges. We get the students to do challenges on campus, and the departments plan the activity, and they get a stamp, which is based on a competency, and we make it fun, and we incorporate faculty in that way. And then COVID hit, and Luzaan got very creative with her colleagues, and we did a World Café, an amazing race, fully online, using different platforms, online tools where students had to post something on Twitter and then write a Google Doc, and then watch a video. And again, the first team to complete all the challenges wins the amazing race. So we're very creative, and we come up with wonderful ideas, but it's to keep the students excited and engaged. And we can tell you all about that in another webinar.
Absolutely. So just a couple of questions still in there. So I think one was answered already by Luzaan about the electronic portfolio system. I think because you're saying you have about 1,000 students every year that run through this. That's a lot to keep track of. So yeah, you must have a whole kind of team though supporting that as well. So you've got the electronic system that you use.
So,
That's what
yeah,
You want to
But
speak to that?
are the stamps electronic or are the stamps like a physical stamp that they're getting when they show up? How does that work?
So for now, everything's electronic because students upload their tasks there. At the Wellness Centre, I do think that we will start becoming a bit more creative and having something a bit more formal, having something concrete on paper or something. But for now, everything is electronic.
Oh.
And
And
everything goes
then,
onto the learning management system. That way, all students have access to it at all times. So,
wonderful. So Christine asked, you mentioned clinical practice, and how do you suggest involving people working in social care and community development who are not regulated in the same way?
I think our attitude at the University of the Western Cape is it's very inclusive. So if I say that, for example, we even have the law faculty that's come on board, and that is part of some of our community outreach programs. Because we realize, that people's needs are not only within healthcare, it extends beyond healthcare. So we've incorporated the law faculty. We are thinking of engaging the education faculty. We are even looking at, we do have a community development component also at the university, and our occupational therapy department is quite big on community development. So if they talk about placing students in the community, they're not seeing, the students are not allowed to see one-on-one patients. It's about thinking about the community as a whole and contributing to community development. So working alongside the community in giving them skills and knowledge and things like that. So we had to think, when we say clinical practice, we have to take each discipline's understanding of clinical practice. And our community sites, which are actually run by our unit. So we've got about 4 communities where we have staff that engages with the community, that plans activities for the students, and that's part of our IPE unit. So they understand what we're trying to achieve. And we then recruit students to come to those communities and to work in an interprofessional manner. I hope I've answered that question.
Yeah. Because I guess I was wondering too, I had written down around the wellness center. So it's student led. Do they do peer feedback, or how does that work then when assessing how they're working together within that community setting?
Luzaan, do you want to answer that one?
thank you. So we actually start with a team discussion on the patient case, and then it moves on to the collaborative practice planning part. So we have a planning framework that we use, and thereafter students actually engage in the clinical practice part. But one of the activities that we've incorporated into that was peer review, because we realized that often students have an inflated sense of self, and they think that, oh, I was a perfect team member, I was doing everything great. But we realized the need, or we identified the need for students to actually peer review and start assessing each other. And reviewing each other's contribution to that teamwork. We just recently also added it into our first year module so that we can encourage peer review from the get-go, for students to realize that this is actually where we are maybe lacking teamwork skills, or I need to build on something a bit more, or I need to develop one of my competencies a bit more for that teamwork activity.
Wonderful. Question from Cornelia around, are there any other educational lessons where students can get stamps in their passport? So do they have to participate in these exact activities, or are there other ways to develop the competencies?
I think the activities are mainly facilitated from our unit, and our team is responsible for stamping the passport and for facilitating. So there's a coordinator for each activity at each year level. So for example, Luzaan is the coordinator of the first year module, and she's responsible for the planning of it, for recruiting of additional staff, for the learning material, to make sure the students attain the necessary stamp that they need to. Then we have another staff member at the second year level who's the coordinator. So each member of our team of the Interprofessional Education unit is responsible for it. But we also engage or involve staff from the whole faculty as well. So for example, the ethics, our deputy dean together with myself, we the coordinators of the ethics module. And then we have representatives from the different department, and the representatives together with us make up the curriculum team, and we decide. So it's not left up to one or two people, but there's a team across faculty to actually decide. Yeah.
Sorry, if I could just add to that, sorry, to the one point that Gérard made. I think what Gérard and I spoke about as we were planning this presentation was, obviously, as you plan presentations, you realize that this is another gap. And we asked ourselves, so what do we do if a student doesn't pass the first year? What if that student, where are we going to give that student another opportunity? So that fits in very well with that question. If there's another place in the student's curriculum in order for them to almost make up that task, should they need it. So it is something that we are going to explore. I don't think Gérard knows that we are going to explore it, but we are going to explore different ways to address possible gaps that the student might have. In a case like our natural medicine students, for example, where they don't join us in the second year for module, what do they do? How do we ensure that they are then identifying or emphasizing the need for an interprofessional identity? What are we doing to almost replace that learning and teaching activity for students who might not reach one of those learning and teaching activities? So it's something that we should explore, and we are going to explore. So it's a valid point, and it's something that we take note of. Thank you.
So is this one thing? I'm just a quick question. One thing that we run into, so for a lot of our students, it's not mandatory that they attend our IPE sessions. How is it for you? Is it still they can still pass and move on? It's not mandatory that they attend, or do they have to pass?
Yeah, I think our activities at the senior years is not mandatory, although for the ethics and the shared research, the credits and the course codes sit with the individual department, so it is mandatory in a sense. But for example, like the World Café is not mandatory. That's an added extra activity. But we are currently engaging with departments to have an assessment component attached to it, so that students must attend and they must hand in something. But I also wanted to add just to what Luzaan was saying previously. She said there's some things that I don't know that's coming, but I think there's something she also doesn't know, that, we thought about having extra activities at different year levels. So things that we are thinking in the near future of having skills labs where students can actually come in and, the skills labs would be centered around the core competencies. And already I'm engaging with nursing around that. Because they've got lovely skills lab, but they are inviting other departments to access the skills labs and to use it differently. So there are ongoing conversations, and we will have activities where if students missed an opportunity, that they can come in and, for example, access the skills lab and do a skills lab around interprofessional communication, and attain the stamp that they did not get wherever. So we've got ongoing activities. The faculty, even recently, like as recent as last week, our management team said, you know what? We need a leadership module. We need a practice management module. So people are identifying IPE opportunities as we go, and it's more and more work for us. And
But it's
but
great that you got that support from
great.
leadership though too, though, and that everyone is looking to you now to
Yeah,
provide that. It's wonderful,
yeah.
excellent. So
Thanks.
thank you very much. I think that we've got great idea there. So I think people are just really loving what you're doing, and thank you so much for sharing it with us today. I think probably everyone's fine to contact you if they've got. There's another question about the assessment tool used to assess team collaboration and team competencies. And you talked a bit about that, and if you want to
Yeah.
answer, Katerina.
Something we're very proud of. So we realized early on that when we're doing our world cafes, for example, that the physios will say, no, but we assess muscle strength in this way. And OTs will say, no, we do it in a different way. And then we realized the need for a common tool whenever we're doing IPE activities. So at the University of the Western Cape, we developed a uniform tool, and the tool, let's see, Luzaan is quite forward thinking. Because we teach primary healthcare, we linked it to that. So we used the primary healthcare framework, and we also used the ICF, so the International Classification of Functioning and Disease. And we kind of just revised that. And this is our assessment tool that all students across disciplines use when we're doing a case-based discussion or in the wellness center. This is the tool that they use, and everybody's familiar with this. So you will see the next slide is the interprofessional care plan. It's based on primary health care. So there you have curative, rehab, preventative, promotive. And the students need to then discuss, what activities will happen at each stage or across each aspect, who will be involved, how appropriate the intervention is, and then when will these activities take place. And then we built in some extra guidelines around prevention, because students often say to us, but isn't prevention the same as promotion? So we just put in some key words to help them think along how this is different to curative and rehab. And this is the uniform tool that we developed. And so all the students know, the different departments know, these are the IPE tools that students use for assessment and for intervention planning.
Excellent. Very exciting. Thank you for sharing. That's really nice to see. Are there any other final questions? We'll wrap it up, but I think it's been a wonderful cafe. So thank you very, very much for sharing what you've done. Again, this is recorded, so it will be up on YouTube, and then so please do share it with other colleagues who might be interested. But otherwise, thank you very much.
Thank you, everybody.
Thank you.